Record. Okay, so our next sponsor presenter is with Saol Therapeutics. We have Noel Costas with us. I hope I pronounced your name correctly. Correct me if I was wrong. But Noel, thank you for joining us. And for everybody listening, if you need a break, please take a break. But if you can hang out for a few more minutes, Noel would like to share with us a little bit more about Saol Therapeutics. So thank you for joining us.
Thanks, Megan. Can Bridget stop sharing so that I could share something?
Yes, I needed to do that. Sorry.
Hi, everybody. Thank you for having me. I've sponsored this as long as I've worked for Saol. Saol is about 5 years old. We are a small startup company focusing on spasticity due to spinal cord injury or brain injury. So many different injuries like that present often either early in your disease or a little bit later on with muscle spasticity. For those that are listening, if you have spasticity, it definitely is something that, oftentimes is your worst symptom that you often go through, because a lot of times spasticity prevents you from achieving goals that you once did, and you still definitely have the chance to live a good quality of life when you're on these various treatments. So Saol Therapeutics bought the product that goes into the baclofen pump. We bought the medication that goes into the pumps. I know we talked a little bit about in Bridget's session, the pain pumps. Spasticity also has a lot of pain associated with it. And the idea for today is just to share with you that if you are suffering from spasticity, you have options. And if you haven't heard of the intrathecal baclofen pump, I'm sure many of you have tried baclofen tablets, which will help reduce muscle spasms as well as relax your muscles so that you then hopefully have less spasticity. And again, I'm sure you and your physician often talk about the daily activities that you would like to be able to accomplish. So the intrathecal pump, which I'd like to show you a picture of it. I could get through this. There's a little delay here. The intrathecal pump delivery of baclofen allows the medication to go through the pump, which is inserted directly. There's catheters on this pump, and it is inserted directly into your spinal cord so that the medication can go right to your spinal cord. It's ideal because it's very, very targeted delivery, as well as you get the maximum amount of baclofen that you can just to your spinal fluid, which is where your symptoms are coming from. So if you can prevent a lot of side effects from baclofen, especially the worse your spasticity gets, sorry, everybody, this has a mind of its own. The worse your spasticity gets, the oftentimes you're going to have an increased dose of baclofen, among other medications. So the idea is to have very little baclofen trickle or deliver via this catheter to your spinal fluid slowly all day, continuously. What's really neat about the pump too is that you can see the picture here. Megan, can you see this? Oh my goodness. Can you see the picture of the pump, or the picture, or our faces covering it?
We did see it, but the slides keep moving.
Yeah. Sorry, we're getting there. So anyways, that's the picture of the pump that you saw for a second. It'll come back because I think I'm just on a delay. But if you can get medication delivered right to your spinal fluid and spare all your organ systems, including the baclofen does cross the blood-brain barrier when taken orally. So if you can prevent the crossover to the blood-brain barrier, you will spare yourself a lot of unwanted side effects, especially if you're still working, or if you're a younger person in school. If this can allow you, again, to not feel tired, dizzy, and all the other things that go along with the blood-brain barrier side effects. This is why the baclofen pump can be a great option. I work with your providers at Metro who either implant the pump. It's a surgical implantation into your abdomen. And you can see those catheters on the top of the pump. That's what then is inserted into your spinal cord to deliver the medication. And my company actually manages the medication side. Medtronic is the maker of this pump, SynchroMed 2, the most commonly used pump. It's 25 years old. It's not new therapy. It's just a therapy that takes a lot of us a little while to understand, get to, and to decide, okay, is surgery right for me? Because I'm just not living my best life. And if you know anything about different surgical procedures, this one, we can do a trial dose with your physician. And what they'll do is they'll bring you in for about a 6-hour period, and you get to just try a small dose of it inserted right into your spinal cord through a lumbar puncture. And as the day goes on, you'll see the benefits of the therapy, and you'll be monitored and talked to by your physician based on your pain, on your function, on your mobility, and the relaxation of your muscles. A physical therapist is often involved evaluating you. It's very much a team approach. You and your caregiver will all make the decision together to see if it's right for you. So thank you for having me today, and I appreciate being involved. And Megan, I appreciate being able to work with you. You're a great hostess, and certainly.
Thank you very much. Does anybody have questions for Mary Noel? I'll admit, I personally have a baclofen pump. I've had one for 12 of my 14 injured years. It's been amazing for me. I will always have one as long as I can.
Good to hear,
it's
Megan.
pretty amazing.
That's a pretty common response from our patients. Sometimes, I mean, Megan obviously got to the therapy pretty quick. Some physicians are more apt to introduce it sooner. Some wait longer just based on their experience with, oral baclofen, other medications, toxin injections, sometimes just sort of, not as much spasticity everywhere. They may be more likely to try a toxin therapy. But most patients, it takes about 7 to 10 years to get to the pump therapy. They last about 7 years based on battery life, and they need to be refilled with the medication roughly every 3 months, but it can be very much tailored to your needs. The less you're being dosed, the longer you can go between dosing intervals usually. And we know that when patients get trialed for baclofen on that 6-hour observation day with their physician, caregiver, and other team members, 95% of these patients go on to get implanted with the pump. That's what a remarkable difference the therapy can do if you actually, have spasticity and you're been kind of identified as the right candidate for it. You can go online to Leorasol. You can see the name of the medication, leorasol.com. Leorasol is just a branded name for the baclofen injection that goes in the pump. But leorasol.com has so much information to help you learn more, decide, and you can always also call Medtronic at thebaclofenpump.com.
Okay, we do have a question. Go ahead.
Hi.
Hi.
I was wanting to know, with this, what type of doctor would you want to talk to if you think you may be a candidate for that? Because I have, for my injury was a T9, T10, didn't get identified right away. And so I have a lot of spasticity in my right foot.
Okay.
And where if you lay your foot flat, mine kind of lays on the side of quite a bit on the side of my foot. So
Yes.
Some exercises haven't really helped with that. So I was wondering if this might be a better solution.
This will help you maximize probably your rehab on the foot. So it is very hard to rehab any stiff muscle or limb. So with this medication, if they feel it's right for you, since it's only in your foot, that doesn't mean they wouldn't try this, but maybe they'd want to do a toxin injection. But you can certainly talk about this with are you being managed by a neurologist or a PMR physician, physical medicine and rehabilitation?
I just started being managed by a PMR doctor.
Okay, bring it up to them. What hospital do you go to?
Cleveland Clinic, but he used to be with Metro, Dr. Neomitis. Am I saying that right?
Yes.
Yeah, I just started seeing him. I've had a lot of other health problems. I have to say he was the most thorough doctor I've ever seen or talked to.
Wow. Good.
Yeah.
Great.
I was impressed.
Yes, you can bring it up with your PM&R physician. Cleveland Clinic has a pump program. Of course, Metro
Oh, okay.
Rehab has a pump program. Neurologists are often involved depending on the injury, but in my experience with spinal cord injury, physical medicine and rehabilitation mostly drive the bus there. And
Okay.
when it comes to being implanted, usually it will be a neurosurgeon. So if you and your physical
okay.
medicine physician decide, either they will do that trial in the office for you or sometimes in a hospital room, but it's usually in an office setting, depending on your needs. And then if you decide you want it, they'll refer you to the neurosurgeon for a quick consult. And some systems implant within a month or two, some take a little longer. But I would say if you're happy with the trial, get it on the books.
Okay, thank you.
You're welcome. Good luck.
Thanks.
Charlotte?
Here I am. Can you hear me?
We can, yes.
Okay. Yeah, I just wanted to let people know that are thinking about the pump. I've had one for 20 years. Of course, it's not my first one. This is about the fifth one. It's the best thing I ever did because when they first implanted 20 years ago, it was a lot different than what they're doing now. My pump has morphine, clonidine, and baclofen in it. And it was the best thing I ever did, was get that in, because I was in so much pain prior and taking so much medicine. It just gets to you after a while when you're on that much medicine. And this, by going straight to the spinal cord nerves, I'll tell you, I don't even have to take any medicine by mouth. That's how good this pump has been working. And I just wanted
Wow.
to let people know that, you know, if your doctor okays it, it's not that bad of an operation. I mean, you're in the operating room for an hour, then you got to wear a binder for about a month and you're off, not even knowing it's in there anymore. So just wanted to let people know how much it's helped me.
Great to hear, Charlotte. Thanks for sharing that.
Sure.
I think that phrase seeing is believing really is appropriate for the baclofen pump. And oftentimes people will just have baclofen in it, but it also has a potential to have, like what Charlotte has. She has a combination of other drugs that go in there. But for the most part, we either see this implanted for just pain patients, same pump with pain, morphine, or baclofen, but they can be combined. And sometimes we're not sure if, pain, if we can reduce the spasticity, can we reduce the pain enough to back off some of the morphine, which is obviously the goal because there's so much pressure on, controlled pain medications in any way. But at least in the pump, you get that slow targeted delivery no matter what it is, and hopefully the best outcome like Charlotte talked about.
Go ahead, Pam.
Yeah, I just thought of another question when you said that. Sorry, I use I don't know if you want marijuana, but I've been on morphine also for gosh, at least 5 years. And my spine bothers me. I'm fused from S1 up to T4. And oh, there's my pain management doctor now. But sorry.
Answer it.
I'm gonna answer it. Hello?
Always answer when the doctor calls.
So I'm going to mute Pam while she takes that phone call so we don't all hear that, but let her have that phone call in private, but she can come back when she's done. Dina, do you want to ask a question? Oh, do you want to ask a question? Dina, did you have a question?
No, it did it by mistake.
Okay, no problem.
I must have knocked into it.
No problem. Okay. Well, thank you, Mary Noel. That was wonderful. And thank you for your support with our forum. We do, really appreciate your continued support year after year. All right, Pam, it looks like Pam might be back.
Yes, Pam is back. Thank you so much. My question was still along the lines of this pump. I've taken morphine for at least 5 years. I'm currently using marijuana too. The morphine, I don't think is doing anything, and my pain is all at the very, very bottom of my sacrum because I'm fused from S1 up to T4. If it's delivered directly into my spinal cord, that may be more beneficial then. Am I understanding that correctly?
It may be, and based on where your pain and symptoms are, they will place that catheter at different, spots along the spinal cord.
Oh, okay, okay.
It's targeted in every way, both placement of the catheter and medication and dosing. And they can. It's a programmed pump through Bluetooth through to an iPad. So when you go into your visit, they can read your pump numbers. They know how much drug is in there. You never want to let your pump go empty, and you never want it to be overfilled. So dosing this is quite a specialty. So the hospital systems here have been all managing this program for a long time. They're experts with the therapy, the dosing. They're training, new physicians on the therapy, but they can dose you at night. They can dose you extra drug in the morning. If you say I'm more stiff in the morning, I'm not sleeping as well.
Yes.
All of that is tailored to what you are trying to accomplish.
That's so interesting. Thank you so much.
You're welcome.
Dina?
Yeah, so I just want to say one more thing. Although I have a different pump than you guys do, and she said it is tailored to you, first of all, the medication comes in, at least my medication comes in from another state. So when you have an appointment, they order it. So you have to keep that appointment because I can't hold on to that medicine for too long. And if you miss your appointment, they actually have to send it back usually. Because it's a mixture. A lot of people get a mixture of stuff and it's done out of state. But another thing is, she said they tailor it to you, which is and it's an exact dose. So it really is, when I go in, before they give me the medicine, they have the machine you could read. Everybody has they could pull it up on the iPad just by touching it. And what I was going to say is that, before they inject it, they always pull out the old stuff so it doesn't sit there. They pull out the old before they put in the new. It's usually about 2-3 milligrams or micrograms. No, milligrams. Yeah, they usually take out the old stuff before they put in the new stuff. They're very careful. They clean you off with that red stuff, orange stuff again. I forgot what it's called.
Iodine.
Yeah, no, it has another name, that ready-made stuff.
Chloroprep.
What?
Chloroprep.
Yeah, they always clean you off. They're very careful during the whole procedure. A lot of times it's done by students. But they're very careful. Like I said, it's all sterile. It's all, like I said, they pull out the old before they put in the new. And the whole process takes 2 minutes. I mean, they know what they're doing. They've done it thousands of times. You barely even feel the needle going in,
Yeah, sometimes it sounds worse than it is, and they're pretty good at the pump itself. I wanted to show you guys what's in the kit. As it was that Charlotte sharing.
My name's Gina.
Oh, sorry. Yes, it's a sterile procedure. The drug is in the front there in that glass ampule, so it's all closed up. It's not refrigerated. So if you're just getting our product only in the pump, the hospital will order this whole kit. It's not as complicated as mixing it the way Dina just said. So, but those are all the things that are in the kit, and it is a sterile procedure, but the pump itself has a pretty big silicone reservoir for them to, refill your pump. So they will deliver the medication in the refill. You see the needles in front in this kit. There's a couple different sizes, and the provider will gauge what size they want to use, but that will go through your skin because the pump is implanted right under your skin.
Mine's like I was saying before, though. You missed me saying before, though. Mine's a little different because I have Medtronics, but I actually have a pain pump.
Okay.
I don't have this one. I have fentanyl in my Pivocaine.
Okay.
So it's a little different. There's not this whole kit.
Yeah, this is more elaborate than the pain pumps.
Yeah, they got a bag and it's, but you know what? When they do trials, like you said, you guys do trials, it's a little bit different because they actually put me in Twilight and
Okay.
they actually put wires in, the same wires that are going to be in when you do the surgery.
Yes.
They actually implant those wires, and they tape them to the outside of your body, even though the wires are implanted, and they run the medicine and they keep you there for maybe a day. And then that's how they test whether it's going to be good for you.
Yeah, that's one way of trialing. Most offices or clinics will trial in a, sort of a procedure room within the office.
Yeah.
But in your case, they probably, if they can place the catheters where they want them in the trial, then they really want to know what your outcome is going to be if they're doing that.
Yeah.
So they probably do it under fluoroscopy. Is that true?
Yeah.
Yes. So oftentimes, if they really want exact precision, especially if you're just somebody who is not responding to medication, or you have some severe injury and severe spasticity going, they'll often suggest doing it the way you described.
Yeah.
But that's not every system. And we always say, like everybody says, if you work at a hospital, or I call on hospitals, you go to one hospital, the other hospital does not do it the same. So it's all different, but it's they all do it based on their experience and the results they've gotten and what they've seen. But if they've one thing to ask your physicians are, how long have you been managing these pumps if you're new to it, like Pam is, so she can get some more background on it.
Thank you.
Awesome. Anything else? I don't see anything right now.
And then I just was going to tell you guys, if you look at the bottom here, leorisolrefill.com, you can see the whole procedure at a snail's pace because it's meant for instructional, but you could actually go to that to see what a refill looks like. It's not actually in the patient, but it'll at least show you the pump and all the things in kind of slow motion, so you sort of see it to understand it.
Awesome. I've tried to video my refill before, and I've been told that is not allowed. So
I know they wouldn't even let me. They wouldn't let me video my daughter when she got her wisdom teeth out because she wanted to see how funny she was. They were like, "No, you can't." But you can YouTube a lot of videos, at least to see the patient trials. And that's a good start too, because they'll show you the before patient when they're very stiff on the bed or maybe walking or in their wheelchair, depending on their presentation. And then over time with the trial, they measure you like at 1 hour, 2, 4, 6, and you really start to see the change. And you'll hear the caregivers in the background on these trials, like as excited as the patient, because everyone's involved in this.
Absolutely. Okay, well, thank you so much again for your presentation and for sponsoring us. We really do appreciate it.
Well, have a great weekend, everybody.
Thank you. You too.
Bye-bye.